Hi, my name is Katerina Wittisch, and my father's really tongue-tied, can't use his tongue at all, and I had a frenectomy when I was 7 because I was tongue-tied, and it didn't make much difference. My tongue looked sort of normal, but I've had really bad headaches my whole life. I have scoliosis, a lot of jaw tension, a lot of problems sleeping, and I had been told that perhaps I should go see an oromyofascial specialist, but I hadn't done that. I actually had to do a palate expansion because I had such bad sinus infections all the time, and I didn't want to do sinus surgery. And the palate expansion helped, and it helped the headaches somewhat, but not entirely. It got rid of the sinus infections, but I still have a very small palate. And eventually after that, I decided I would go see Joy, Joy Moeller, and I would go have an evaluation. And she suggested right away when she saw how I was swallowing that many of my issues, including the not sleeping, including the constant headaches and the TMJ, might really change if I had a deeper frenectomy, that my adhesions, I don't know what you call them, were deeper in and were submucosal, and that they had not been disconnected in the first surgery. So I came to see Dr. Zaghi, and he agreed that this would make a big difference. And I had a tremendously forward neck when I came to see him. I was sort of like this all the time, and lots of tension all the time in the jaw, the back of the head, constant headaches. And the experience of the surgery was really amazing for me because I was scared of it because I'd had this botched one when I was 7. And Dr. Zaghi and his assistant were incredibly present and kind and informative, so that it wasn't so scary to do. The actual procedure was not painful or difficult really at all, but what amazed me during it was I had pretty deep a need to go pretty deep to cut the cords. So what was amazing to me was that the first layer of cords I didn't feel much, and I thought, oh, I'm going to be the one person this doesn't really change. And then the second layer, I started to feel this opening in the back of my neck, in particular where the neck connects to the spine. But the third layer, when he clipped them, it was like everything in my head and back opened up. And so now you can see that the way that I hold myself is completely different. This would have been impossible before the surgery. So in 1 second, there was this feeling of, oh, everything opened up. The pressure in my jaw is gone. The pressure in the back of my head is gone. All kinds of possibilities are opening up. I've had a little bit of a dance with my scoliosis because once things started to revise themselves, my dowager's hump, which I had a really big one, gone in 1 second flat, but now the rest of my spine has to adjust to that. So I've had a couple of weeks where things keep coming and going, and they're not necessarily so comfortable. However, I seem to be coming to the end of that already, so it's only been a month since my surgery, and mostly just what I feel is this tremendous expansion and a lightness in my head, neck, and jaw that I couldn't have imagined before. When it happened, I thought, oh, this is what normal people feel like. This is how easy it can be to be in the world. And the fascinating thing, because I work with people's emotions, I'm a somatic therapist, is to notice in myself how from the second that those last cords were clipped, there's a sense of ease in the world for me that wasn't there before. I'm not taking anything quite as seriously. I just have a fluidity and a sense of balance that I didn't have when I was always like this. So now there's so much possibility opening up. So I'm so grateful I've had this surgery. I wish I'd had this deeper one when I was 7 and didn't have to have this long process. So I would, to any parent who has a child, if your child is struggling with headaches or sleep problems and you know that there's some degree of tongue-tiedness there, if you could gift a child with what has just happened for me at the age of almost 60, if you could give it to a young one, it'd be pretty amazing to not spend your life struggling with this tension. And those of us who have spent our life struggling with this tension, to us it's normal. We don't even know there's another possibility, but to find this other possibility now is really, I don't have words for it. I'm so grateful for it. And if you have a child who might have this issue, the surgery is minimal in comparison to the gift you could give them. So I would strongly suggest it.